Hello, everybody. My name is Sarah Cooney, and I'm an MPH student at Arcadia University. Depression is one of the leading causes of preventable mortality and morbidity globally and affects women twice as often as men. Some attribute these elevated depression rates among women to risk factors associated with female sex hormones and various types of hormonal contraception. This project focuses on oral contraceptives, or OCs, which are one of the most common forms of birth control for females and are used by millions around the world. Despite its popularity, many females discontinue OC use due to reported negative mental health effects. Unfortunately, scientific evidence describing the association between OC use and mental health outcomes is mixed. More research on this topic is needed to better understand the risk of OCs. Additionally, this project will focus on age at menarche. Menarche is the first onset of menstruation in females that occurs during puberty. Since menarche involves the influx of female sex hormones, it is hypothesized that early menarche and longer hormone exposure increased risk for mental health problems. The primary objective of this study was to evaluate the relationship between current or past OC use and depression among adult females of reproductive ages. A secondary objective was to explore the independent effect of age at menarche on depression risk. We conducted a cross-sectional secondary data analysis using data from the 2015 to 2016 and 2017 to 2018 cycles of the National Health and Nutrition Examination Survey, or NHANES. Analyses were based on 2,544 adult females between the ages of 18 and 49. Depressive symptoms were measured using the Patient Health Questionnaire, or PHQ-9. The PHQ-9 is a 9-item survey which evaluates the presence and severity of depressive symptoms in the 2 weeks prior to assessment. We used a cutoff score of greater than or equal to 5 to indicate the presence of mild depressive symptoms and conducted complex samples logistic regression analysis. Participant characteristics are represented in this table to the top center. 74% of study participants reported current or past OC use. OC users tended to be 35 to 49 years of age, non-Hispanic white, college educated, with higher income, and married or partnered. Body mass index did not differ between OC users and non-users. In bivariate analysis, level of depressive symptoms was significantly greater among OC users compared to non-users. This is represented here by this figure at the bottom. In multivariate analysis, after controlling for sociodemographic variables and BMI, current or past use of birth control pills was significantly associated with increased odds of mild depressive symptoms, and age at menarche was inversely associated with mild depression risk. This is shown by this table to the top right. In conclusion, these results show that OC use in earlier menarche were positively associated with depression in females of reproductive age. OC use increases exposure to exogenous low-dose hormones, and earlier age at menarche increases the length of exposure to endogenous hormones, which both implicate female hormones in the risk for depression. The association between OC use and depression became stronger after adjusting for sociodemographic variables, most notably income, indicating the importance for controlling for potential sociodemographic confounders in studies of OC use. Results from this study can be used to shape future education programs regarding reproductive and mental health. This information can aid women and medical providers in making a more informed decision regarding contraceptive practices. Here, focus on safer alternative methods of contraception and hormone risk by type may be beneficial. By knowing the possible depression risk associated with OC use, adverse outcomes can be anticipated and minimized. Much work remains to be done before a full understanding of female depression risk is established. Future prospective research on OC use by age group, hormone type, and duration of exposure can help establish temporality and causality. Thank you.